Okay, so welcome to this next video in the playlist on angiogenesis. In this video, what we're going to talk about is a pathological process that involves angiogenesis, and this is diabetic retinopathy. Okay, right, so diabetic retinopathy is the topic for this video. Right, so we're going to start our discussion of diabetic retinopathy by discussing the structure of the eye, then we'll progress to the structure of the retina, and then we'll discuss the actual pathogenesis of it. Well, the pathology of it. We're not actually going to discuss the pathogenesis of it because the pathogenesis of it isn't really well understood. Basically, we'll just say hyperglycemia causes this. Okay, right. So, we'll start off then just with a bit of anatomy, basically. We'll start off with the structure of the eye. Okay, so, it's always a good starting point to start by drawing a great big circle. So, this is going to represent the sclera here, so I won't complete it yet. And this is the optic nerve coming out the back. Okay, like so. So, this is the sclera. Right, and of course the sclera is continuous with the outer lining of the optic nerve here. Okay, so we'll make sure that that's obvious here, like so. Okay, and then we'll have the nervous tissue of the optic nerve here, with a canal running through the middle through which the central artery and vein will run. Okay, and of course the nervous tissue is then continuous with the retina. Before we start the retina, there's another layer that's underneath the sclera, so I'm going to have to finish the sclera off at the moment. So I'll bring this right round here, like so. And I think I'll colour in these bits in different colours so that it makes it nice and easy to distinguish the different layers of the eye. So this is all sclera at the moment, and of course the sclera will then be continuous with the cornea at the front. So let's try and draw the cornea. So we'll have this portion right at the front here representing the cornea. Okay, right. So this sort of little edge out over here is going to be the cornea. So this is sclera, and I'll colour this in. Actually, I'll leave this in white since it actually is white in reality. So this is the sclera. Okay, and at the front it's not called the sclera, instead it's called the cornea. Okay, and I'm sorry about this, my pen is already running out. We'll continue this discussion in the next video once I've got a new pen.